Usually we talk about how much more expensive it is to be uninsured in America. If you don't have insurance, you are likely to go bankrupt with the exorbitant healthcare prices here in America. But in some cases, people without insurance end up spending less out of pocket. And I'm gonna highlight an issue or a specific example that was written about in a column in the Los Angeles Times. It had to do with Mika Moore and her husband. They both needed to get some ultrasounds done. However, her ultrasound indicated that there might have been some internal bleeding. Now, Moore's insurer, Cigna, was charged $2,758 by the medical center for the 2 ultrasounds. However, Cigna gets a contractual discount of just over $1,000 because it's, well, Cigna. They're able to negotiate. All insurers cut sweetheart deals with medical providers. I don't even know if I call that a sweetheart deal. They get to negotiate with the healthcare providers. That's the way the system works. So that lowered the bill to $1,739. Cigna paid $500. That left a balance of $1,239 for which Mika was entirely responsible for because she hadn't met her $1,250 deductible for that year. All right, hopefully you guys are following along. I know it's confusing, there's a lot happening, but just understand that you have health insurance, right? And the negotiation happens behind the scenes between the private insurer and the doctor's office, and then you have to meet your deductible. And a lot of times, that deductible is pretty high. Moore said that after working her way through various levels of customer service in the medical center's billing department, she learned that the cash price for the 2 ultrasounds was $521. In other words, if Mika hadn't been insured and if she was paying completely out of pocket, she would have been charged a fraction of that insured cost, right? So there's a few things happening here. First off, there's no transparency in our healthcare system. So you don't know what the cost would be out of pocket. You don't know why it is that the negotiation starts off so high when it's the doctor's office and the insurance company doing the negotiation. You don't even know how this is all working out behind the scenes. There is no transparency, and the healthcare industry fights very aggressively to keep things very opaque, right?
Yeah.
So I'll give you more details, but I want you guys to jump in.
The $1,000 discount for the Cigna Sweetheart deal, it does mean something to me because we talk about how much. Okay, so this lady had to pay $1,239 after the end of all the discounts. Do you think they're gonna say, hey, sweetheart, just pay $239, drop that $1,000? No, but for some reason, Cigna, because they're Cigna, gets a $1,000 discount for who? I thought we're talking about how struggling these companies are, the healthcare industry, and then the drug companies. They're struggling, they need more money. But somehow they can drop $1,000 for apparently no reason. That's fine because the money will continue to flow. But when they send you that bill, they're like, hey, 60 days is up, bro. Where's my money? 100%. But they won't ask Cigna for that extra $1,000. Anyway, so there's that part. So at the end of this, $521 is the target number here. Again, we talked about the drug prices in the last block. Who has $521 because they went to the doctor and they told you got something wrong with you? We gotta need to take some blood work, some x-rays, some scans. You might die. $521. And then somebody goes back home and says, man, I got 210 in the bank. What are you supposed to do? Again, the fact that our target price here is still exorbitant to me. We're starting in a horrible place and we're going back to just a bad place, to where none of it should be happening this way. Other folks that don't have to worry about this changes your quality of life and you will get sick because you're worried sick.
What I don't get is, first of all, again, the biggest issue is that there's a lack of transparency, because if you're armed with the knowledge necessary, then, first of all, do the health insurance companies not know? They know. They have to, and if they don't know that it's only $500, a little over $500 out of pocket for this ultrasound. This is what I don't get. Like, the insurance company that's negotiating on your behalf should ask themselves, why is this person getting charged over $2,000 for an ultrasound? Does it really cost $2,000 to do an ultrasound?
Yep.
That's the dance that the insurance company does with the healthcare industry, and you'll find it in, of course, any kind of hospital stay where they're just charging these ridiculous prices for everything from, aspirin to some kind of penicillin to, the things that you can get over the counter. In the case of aspirin, let's say, or ibuprofen, and they'll charge incredible markup. As Anna says, it doesn't make sense. Look, it does two things. Of course, the transparency. It points up how there's a lack of transparency. That's a huge issue, and they want it that way, as you said. But I think it also points out there are such enormous complexities to this healthcare industry that you realize how difficult it is. There's so many competing interests, how difficult it is to wrestle it away from those interests. And that's the real mountain we have to climb as progressives, I think.
Which is why it's important to pay close attention to whether or not Democratic candidates want to protect private insurers. Their obsession with protecting private insurers is a giant red flag, because protecting private insurers means that they would keep this two-tiered system, right? And when you have a two-tiered system like that, where some people have a public option, think about how that public option will be gutted, right? Think about how it will be underfunded so it does not cover everything you need. When you have everyone in one system, you have the leverage to negotiate and lower the costs and the prices for these drugs, for these services. I mean, it's common sense. Look, private option would be a million times better than the situation we have today, but why are we shooting for a middle ground when we can have much better?
On the go? Don't worry, we got you covered. You can still listen to TYT at our new podcast network. Find us on Apple Podcasts, the Google Play Store, or at tyt.com/podcast.